Why is the US facing a massive physician shortage, and what will it mean for your practice and your patients in the next decade? Stay tuned for the data, the history, and the hope behind the unfolding crisis. Hey, Doc. Welcome back to the Resilient MD, the podcast and YouTube channel where we talk honestly about the reality of medicine, the pressure physicians are facing, and how we rise above burnout to reclaim our purpose and our lives. I'm Dr. Anna McDowell, certified life coach, a practicing allergist, and a physician deeply invested in the future of medicine and the well being of those who practice it. Today, we continue our deep dive into the structural problems facing medicine in the US, but with a sharper lens. We're talking about the growing physician shortage, how it got here, what the data says, what's fueling the shortage, and the legislative and systemic efforts underway to pull us back from the brink. If you've ever wondered whether this shortage will matter for your patients, your practice, or the future of healthcare in America, this episode is for you. So, what is the scope of the shortage? What's the forecast is telling us? Well, according to the Association of American Medical Colleges, the US is projected to face a shortage of up to 86,000 physicians by 2036. And unfortunately, the shortage won't hit all areas equally. Rural and underserved areas are expected to be hit the hardest. Even specialties like primary care, mental health, and other critical fields, which many communities are already struggling with, will be disproportionately impacted. And this is not a distant problem. It's actually unfolding right now and will shape whether patients can't find doctors, how long they will wait, and how sustainably care can be provided to them. But why? Why are we facing this shortage? Well, there are several deeply embedded structural reasons. It's not just simple lack of interest. A big one is the cap in training Medicare residency slots. And it's one of the biggest drivers was a policy decision made decades ago. In actually 1997's when Congress imposed a cap on the number of residency positions funded by Medicare. What that means is that in practice, even though there are more medical school enrollment, and that increased dramatically with more physicians wanting to train, the number of available residencies did not keep pace. So fewer new doctors are completing their training. This mismatch with more medical school graduates but stagnant residency capacity is a structural bottleneck. Another factor is the aging population combined with the aging physician workforce. That is increased demand with an aging population having more chronic diseases, which increases the complexity in the medicine that needs to be delivered to them. And that drives more demand. And at the same time, of the current physicians are nearing retirement. That combination increases care while shrinking the supply of providers. Another factor is the geographic and specialty maldistribution. So even if all the numbers looked okay, the distribution remains deeply uneven, with the rural and underserved areas still struggling disproportionately. Similarly, there are certain specialties, especially primary care, psychiatry, and geriatrics, that are underserved and undersupplied compared to the needs that they have. Another factor is burnout, with the administrative burden, loss of physician autonomy and satisfaction. As we have uncovered in past episodes, many physicians are leaving or reducing their hours, not because they don't love medicine, but because the system is exhausting. The heavy administrative load, the productivity pressure, the stress, the moral injury. And when doctors leave the clinical practice or retire early, the shortage just intensifies. Another factor is a pipeline issues in immigration and international medical graduate. So the international medical graduates have been important part of the workforce, especially in underserved areas. But there are delays in visa processing, fewer spots available, regulatory challenges, and these all hurt that pipeline. So, when you add all of these together, the demands are rising, the supply is constrained, there are many opting out or downsizing, you end up with a massive gap. And why does this matter and what it means for you? Why should you care even if you're in a specialty that seems stable right now? Well, ultimately, this will affect your patients because there is going to be longer wait times, less access, and more fragmented care. It's also going to affect your workload. There will be fewer physicians, which means more coverage demands, more calls, and ultimately more burnout. It can affect your future career options, less flexibility, fewer practice models, more corporate consolidations. It can also affect your values. If we lose autonomy, there are fewer physicians choose medicine, the system shifts further away from patient centered care. And this is not abstract, it's actually personal. So, what is being done and what are the proposed new solutions? The good news is that in recent years, lawmakers and medical organizations have started responding to all this. There's a recent incremental steps. Under the Consolidated Appropriations Act in 2021, an additional 1,000 Medicare funded slots were allocated. This is a modest but symbolical move forward. And then starting in 2023, CMS began awarding up to 200 of these slots per year until they are filled. And there was an expansion of the Medicare funded residency slots, which was a key legislative response. It was the Residency Physician Shortage Reduction Act in 2025. This was a bipartisan bill that will add 14,000 new Medicare supported residency positions over 7 years, 2,000 per year from 2026 to 2032. Now, importantly, this bill prioritizes hospital in rural and underserved areas in regions with greatest workforce needs. This will be the largest expansion in training capacity in decades. It's a clinical step towards relieving that bottleneck. One of the important things of this bill is that it focuses on underserved and rural areas. This new legislation and policy isn't just about more doctors, but about where we need them most. Rural and underserved communities are prioritized, which may help ease disparity in access in these areas. There is also an effort for broader workforce strategy, more than just physicians, because increasing residency slots alone won't cover all shortage areas, especially in the near term. So many health system leaders and policymakers emphasize team based care using nurse practitioners, physician assistants, telehealth, and other models to stretch the workforce capacity while new physicians are in training. The Healthcare Workforce Resistance Act is a bipartisan bicameral legislation introduced in 2025. It proposes to recapture 15,000 unused immigration visas for physicians and 25,000 for nurses to expedite the international medical graduates into U.S. practice. Now, even these measures need a stable physician pipeline to anchor quality practice. Hey, Doc, if this year has felt heavier than you expected, you're not alone. Maybe you've been pushing through long days, feeling drained before you even get to work, or wondering quietly, is this just how medicine is nowadays? I know that feeling because I've lived it. As physicians, especially as women in medicine, we carry so much more than anyone realizes. The emotional load, the invisible work, the expectations, and somewhere along the way we forget ourselves. But here's the truth. Burnout doesn't mean you're weak. It doesn't mean you're failing. It means you've been trying to hold everything together on your own for far too long, and you don't have to. This season, as we move into a new year, I want to offer you something different. Not another resolution you forget by February, not another productivity hack, but a real chance to change how you think, how you feel, and how you experience your life and career. That's why I created the Resilient MD, a 6-week one-on-one physician coaching program designed specifically for a women physician who feel overwhelmed, stuck, or on the edge of burnout. Together, we'll uncover the thoughts driving your exhaustion, reshape the actions that are keeping you stuck, build believable bridge thoughts, and create a plan that brings your life back into balance with clarity, purpose, and compassion. So if you're feeling the weight of this past year, if you're craving a change, if you want to walk into the new year lighter, clearer, and more in control, make this the year you choose you. Make this the New Year's resolution that actually counts. Your transformation can start right now. Click the link, sign up, and let's begin your journey to becoming a truly resilient MD. You deserve to feel like yourself again, and I will be right here to help you get there. So what does this mean for physicians, patients, and the future of medicine? For physicians, increased resident slots may expand hiring, reduce overwork, and help staffing, but only over time. For patients, if training increases proceeds, access to care may improve, fewer medical deserts, shorter wait time, better distribution, especially in rural and underserved regions. For the profession as a whole, if in the system, this could help preserve physician-led care, reduce the pressure on existing clinicians, and protect the art of medicine from being fully corporatized or overburdened. But, and this matters, passing legislation doesn't guarantee immediate relief. It takes years to train new doctors. So short-term strategies, team-based care, retention efforts, advocacy remain crucial. And here's what we aren't seeing, and what's honestly startling. That's very little conversation about strategies to reduce burnout among the physicians who are currently carrying the system. The seasoned clinicians, the teachers, the mentors, the ones that will be training all the new residents we hope to bring in the US. We talk so much about fixing the pipeline, but almost nothing about caring for the people who are already in the workforce, drowning in administrative burden. A perfect example, in mid-2025, we heard big promises from insurance companies about reducing prior authorizations, pledges to streamline, simplify, reduce barriers. And yet, starting January 1st, 2026, 17 medical procedures under traditional Medicare will now require prior authorization in certain US states. So instead of decreasing barriers, they are actually creating more. And the proposed solutions, things like implementing prior authorization interfaces, they call them APIs, to automate the process, or legislation aimed at shortening insurance response and time. Now, don't get me wrong, APIs and faster responses are better than nothing, but they still operate under the assumption that prior authorizations are necessary in the first place. And legislators don't realize they cost money and time for the providers anyway, which will not reduce the burden, will ultimately increase it. Maybe, just maybe, the innovation we need isn't another digital workaround or a bureaucratic timeline. Maybe the radical groundbreaking idea is simply reducing legislation and letting physicians take care of patients. Can you imagine that? What an innovative concept! It's revolutionary, even. Well, thank you for listening and your honest willingness to look at this with me. The physician shortage is not just a statistic, it's a looming reality that will affect all of us doctors, patients, communities, and the very foundation of care in this country. But there is hope. The newly reintroduced expansion of residency slots, a renewed legislative push, and growing awareness of the crisis give us a real chance to influence change. As physicians, especially physicians who care deeply about medicine's meaning and impact, we have a role in advocacy, in mentorship, in staying committed, and in speaking up for our patients and our profession. So let's do it. Now, in the upcoming episode, I have a bombshell surprise for you. Please keep in touch because I love to know about topics you would love to listen to. And don't forget to click that subscribe button so that you don't miss any of the episodes. And let's turn insight into action. The time management series laid the groundwork. Now grab that guide that helps you put it into action. Learn how to reclaim 10 plus hours a week and finally breathe again. Get your copy at annamcdowell.com/guide or hit the link in the description below. Your feedback means so much to me. If you found today's episode helpful, please consider leaving a 5-star review on Apple Podcasts or your favorite platform and liking the video on YouTube. Every single one helps this podcast grow and support more women like you. I'm wishing everyone a wonderful Christmas if you celebrate it, and a happy holiday if you don't. Take care of yourself, stay connected to your purpose, and let's keep holding space for a medicine that honors healing, humanity, and our shared future. I'm Dr. Anna McDowell, and you are Resilient MD. I'll see you next time.